Surgeon General and Governor's Chief Medical Advisor. And now to Governor Leongara for her opening remarks.
Thank you, Janella. Half a day. Our numbers over the past few days have been promising and have shown that our measures are working. Our measures were implemented early, aggressively, and very proactively, guided by science, sound medical advice, and what we learned from other countries. With 5 deaths and 114 recoveries, this means we have 17 active cases of COVID-19. We are continuing to monitor, diagnose, treat, and isolate these cases. As we begin to draft guidelines for reopening our island, we must remember that any plan to lift restrictions must be slow and happen over time. So much of our recovery depends on getting it right. Opening too soon can mean a resurgence of new infections. In that event, we must be ready to identify, test, and isolate all new cases and trace every contact they make to stop further transmission. As part of this effort to expand our current testing capabilities, the Department of Public Health and Social Services and my Physicians Advisory Group, in coordination with the Mayor's Council of Guam, will be launching a pilot program in the Extumbo housing area in Adelup this Saturday, April 25th, from 9 o'clock to 12 p.m. They will be testing individuals with mild to moderate symptoms of COVID-19. The purpose of this pilot is to identify vulnerable groups for whom testing may not be readily available or accessible, and we will also be allowed to learn and improve our methods. Over the next few weeks, and if we are at full testing capacity, utilizing FDA-approved machines and test kits, we expect to begin testing 258 individuals per day. This level of testing is one of the conditions needed to safely begin to lift some of our current restrictions. Remember, a single case can quickly lead to a large cluster. COVID-19 is 10 times more deadly than H1N1. Easing restrictions cannot come at the expense of people's lives. Social distancing will still be crucial no matter what stage we are in. None of us want to go through this again, not in a month, not in a few months. If we remain committed, we will overcome this sooner rather than later. I know I also now would like to have Linda do some updates on our
today, and we're still at that level. I'd like to just remind everyone that you can log into our website at the Department of Public Health to get the latest dashboard. It's updated every day on all the cases that we have of COVID in regards to the numbers that have recovered, the current cases, and also the age, the sex, and other areas. In regards to that, I also just want to, Governor, give an update as far as of those that are having no travel history. Of the 136 cases, 118 have no travel history. And of that 118, the breakdown are as follows: 36 are household contacts, 13 are community contacts, 19 are healthcare contacts, and that's also broken down into those contacts as a patient, which is 5, and as a healthcare worker, 14, and no reported contacts, 50. And that amounts to 118 of those cases. We continue to quarantine all our passengers that arrive on Guam, and those that are currently under quarantine is at 199 as of today. And we also would like to report those that have completed their 14-day quarantine. And as of yesterday, the 20th, we have 15 that have completed. And so now our current number total from April 2nd through April 20th is 354 that have completed. We currently still have 7 in our isolation Government of Guam unit. And for more information as far as the COVID recoveries, they're located at our dashboard at our public health website.
Thank you. Thank you. I also like to ask Dr. Michael Cruz to maybe give us an update of what he sees that would trigger our recovery.
Right, so one of the things that we need to do is to increase our testing capacity. And today, in fact, Public Health and our Physician Advisory Group are meeting this evening. We want to look, if as we go into the road to recovery, we need to be able to understand the actual prevalence of the disease on island. In order to do that, we need to increase our testing capacity. We do know that there are multiple agencies now, both private and public, that have machines coming in that's going to increase our capacities. And if we can get the required testing kits and reagents and other consumables to do it, then we should have a plan for a wider testing of the community as a whole, hopefully in the next couple of weeks.
So we're open for questions now.
Okay, just a reminder, you get one question and one follow-up. We'll begin with PNC Kevin Kerrigan.
As half a day, Governor, I have a question about this morning's post on Facebook. You described 3 criteria essentially that needed to be met before any restrictions can be lifted. 14-day period of low to no positive cases, sufficient bed capacity at the hospital to handle a potential second wave, and sufficient testing capacity. Have we met that criteria?
So the hospital capacity based on now what FEMA's numbers are looking at. By the way, the doctors have been working with FEMA to readjust the trajectory and so forth. And so based on our mitigation efforts, Kevin, which we have done, like I said, early on, first week, second week of March, and aggressively done initiatives and directives to improve and increase social distancing, stay at home, hand washing, all those measures that are mitigation measures to decrease the risk of exposure. So we have been doing that from like March 14th moving forward. So because of that, FEMA recognizes our efforts. And so they readjusted our trajectory to saying that at the peak, we would need about 40 bed capacity, and we can meet that now. As far as the 14-day, if we start looking at April, maybe 10th, 11th, where we are seeing mostly 0 positive cases and maybe 1 or 2, we can say that for the 14 days, we have sustained that slow spread of infection. And then, of course, testing, and what Dr. Cruz has mentioned about testing, we have about 6 machines on island, together with GRMC's capacity, together with our capacity in public health, and also GMH's capacity. We will have the testing capability. We are also getting more test kits. Linda is being assured by CDC and also the World Health Organization that we would be getting 200 tests for our rapid testing this week, another maybe 200 again this week, and then we will be getting 200 tests every week moving forward. The other one is, of course, the PCR, which we are going to be getting test kits from that would continue doing about 40 a day. The rapid testing one, I think, can do about, hold on, let me just get this information so I'm telling you the most accurate one. Yeah, the rapid ID test, here it is. The ID now, if both machines with the test kits that come in can do about 124 a day, then we have the BD Max, which GRMC already has the BD Max. They're in the process of validating it, and also the test kits, and that's about 220 tests a day. So with numbers that are being done and with data that FEMA is looking at, they're saying that if we can have the capacity of 258 tests a day, that's a trigger to start lifting things up. So we will meet those. Also, the Gen Expert, we have that machine. That machine will give you results of about 284 a day. And then one is at public health and one is at GRMC. So with all this, we will, I think, meet the 258 sort of indicator that would trigger us to start lifting. So this is why I'm very urgent about launching this pilot project that we're doing in Astumbo to get us going in a better, effective, efficient way when we do expand it and open it up to more people. Additionally, my advice from Dr. Mike Cruz is that we need to also target more of the people that are also at a higher risk. Like, for example, those that live in multi-generation homes, those that are also our healthcare frontliners. By the way, the tag is going to be also doing testing for her soldiers. And we are also going to include the Guam Fire Department and also GPD in that testing. So we're going to start testing the population of first responders. So to your question, I know it's a long answer to your question, but yes, we do have the capacity. And once we start getting data, Kevin, from these testing sites, I'll be able to be more comfortable and confident, and also with Dr. Mike Cruz and Public Health to see how and also the recovery panel advisors. They get all this information and we gave them our recovery plan. They're looking at it right now. And so once we get all that approved and finalized, I'm hoping by this Friday that the whole of next week we will be doing more testing so we can have a better picture of the community spread in our island.
Kevin, if I could just add one more thing to the statement. I think we'll probably in the next day or so share the reconfigured models on the projections as far as our bed capacity and the likely going forward. With FEMA's models and putting in the full mitigation efforts that the governor has implemented over the last several weeks, it shows there's been a significant decrease in the actual bed gap or the bed delta that needs to be met. And we're pushing a peak and flatten the curve significantly over a longer period of time so that our healthcare resources would not be overwhelmed given the current FEMA modeling that allows for the full mitigation efforts that we've been doing here on Guam.
Yeah. And you know, maybe there's a question out there about, you remember the initial trajectory that we were sending out? Those were done with little history and data. But now that we have actual data for over the last, I would say 5-6 weeks, we can now better adjust our trajectory. And I understand that data was also done without the mitigation measures in consideration.
Thank you. And just as a follow-up, if I might ask Dr. Cruz to elaborate a little more on the trajectory. We had heard a couple of weeks ago that we might reach peak in the second week of May, even as late as June. It sounds like that has been revised now based upon your conversations with FEMA. But what is the trajectory now? Most importantly, have we passed the first peak? And what are the prospects for a second wave?
I think with any of these type pandemics, they come in waves, right? And I think that certainly we are probably past that first wave. But clearly, as we sat with FEMA, on the initial models that FEMA looked at, they had no mitigation efforts at all that were part of their model. So that was even as of 2 days ago. So yesterday, Dr. Cabrera and I sat with the FEMA team, both at Region 9 in San Francisco and also on the East Coast with the Johns Hopkins Applied Physics Lab. And we said, listen, there's a bunch of mitigation efforts that we've implemented, the governor has implemented, and we think that these mitigation efforts should be applied to the model. In addition, we want to add in the real data that we have, data being hospitalizations, the number of positives. And by doing this, the Kinsey model, which is the Johns Hopkins model, actually showed that at least almost a 60% decrease in the spread rate on the model, which pushes the curve or flats it out significantly so that any peak that we may have may actually happen later in the fall, probably towards September or October timeframe. And that allows us then to meet the needs as far as our hospital resources. So I think we should share that model with you, and probably in the next press conference, we can go ahead and do that.
Thank you, Kevin. Mariana's Business Journal, Maureen Maritita.
Buenas, everybody. Linda, Dr. Mike, Governor.
Hi, Linda. Sorry, Maureen.
Yes, ma'am, I know you meant me.
I call everybody Linda, I'm sorry.
That's quite all right. You can call me whatever you like. So my first question, we're talking about testing in Estumbo and frontline workers. Being as we're looking forward to opening the community for commerce again, will there be a provision to include, say, restaurant workers, people who might interact with the public? Would they be tested?
You know that they haven't been discussed in the course of the expansion of the testing, but I will tell you that even as we move forward and we start lifting things, we will continuously be tested. And if there is the need to assure the public that the restaurant workers is a high-risk area, we certainly will look at testing them. But right now, because we're still not fully at the capacity because of the test kits, we are slowly and we are gradually actually bringing out the tests with targets of selected groups of populations that we feel are a higher risk. And my medical advisors have listed those priorities, which is still everyone and people that present themselves at the hospital, our first line responders, our healthcare workers, of course, the Manumku, those areas that there's a high possibility of that if one gets infected, that a great risk of more people in that area would get infected. That's sort of the guide for that one. And of course, multi-generation family household is also another big concern. And of course, these pockets of areas that public health epidemiologist feels that we haven't really gone in there to actively find cases. And once we find those cases, this is the approach. We isolate that individual that's become positive. Either we home isolate them based on do their homes meet the CDC guidelines for home isolation, or we take them to our government facility for isolation. So the thought there is remove the cause of the transmission and then monitor the rest of the family there, test them also to make sure that they're not positive. So we take the positive away, we contain them for 14 days, that's the life of the virus. We also do medical checkups every day, and then we test them twice. And if they are negative within 24 hours, then they're considered COVID negative, and then they can be released home. So we're going to continue that throughout the course of reopening, and I think we'll also continue it till maybe we get the vaccine, because it's very important that we don't reinfect and we don't get recontaminated. Do you want to add anything?
Yeah, in addition to all the special categories or priorities that the governor has stated, I think it's anybody with COVID-like symptoms. And so if you have symptoms of cold, cough, fever, flu-like symptoms, or loss of smell or loss of taste, it's important for you to go into the clinics, to any of the testing agencies and get tested.
Okay,
Right. May I also ask something?
Yes,
to
Linda
that?
wants to add,
Part of
Please.
this small pocket also is when we identify somebody, as the governor indicated, that is COVID positive, we are also going to do our tracing our household contacts and also the close contacts. And if we find out that all these individuals have been linked with that positive COVID patient, we also would like to test them even though they're asymptomatic. And that's part of the reason why we're launching this pilot study.
all right.
So my second question, human nature being what it is, and the fact that some people have a natural fear of the medical profession and tests, what do you do about people who decline to be tested?
We at
Go ahead.
Public Health, we try to encourage them. We try to give them some counseling, some education. We try to tell them the benefits of being tested and how it would help us not only to identify if they're ill, but also to protect their other family members, their loved ones, and also their friends and their families. If it comes to the point that we try with whatever educational intervention that we've implemented and they still say no, the best that we can do is to just document that in our medical record and also to closely monitor if there are other members of their family that could be at real great risk, i.e. there are other households in the family that are elderly, that are very vulnerable, and also people that may have in their family comorbid conditions. And so this is the reason why we always emphasize if they are to be saying no, it's okay. I don't think it hurts for us to call them and just check on them just to make certain that if conditions change in the family. We've had cases like that too in our quarantine sites where individual was not very happy that they were quarantined, but over the course of the time and during their incubation period, they ended up getting the symptoms. And obviously with those people that ended up being symptomatic, they got tested and then became positive. And so there's that change of behavior that occurs. Now, realizing that they are positive, that attitude and that behavior now has shifted totally 360-degree turn. This is what we're trying to do at Public Health. It's very difficult to change behavior. We can only do that through education, knowledge, attitude, but the most difficult part is changing the way they behave. And again, we can educate and keep educating, and that's exactly what the Department of Public Health is doing, launching so much education to get it through to them. And whether we have to educate the child so that the child can be the one to be instrumental to their parents or even their grandparents to change their attitude, that is what it's going to take. And again, just changing that behavior is key, and that's what we're working on.
Thank you, Maureen. Guam Daily Post, John O'Connor.
Hello, Governor.
Hi, John.
Yes, thank you. I believe it was yesterday you said you were going to take part in a phone call with the Vice President and President.
Yes.
Can you provide us some details on that? Did that already happen? And can you provide us some details on it?
Yes, it happened this morning at 1:00 a.m. And it was the president was not there. It was the Vice President, Mike Pence, who the president has designated as the lead for this response to COVID-19. And he had again his group of experts there, Dr. Burks, Mr. Peter Gaynor from FEMA, and so forth. And as they didn't go over all the details of the guidelines because that was our last meeting, but they talked some more about testing capabilities, and they talked about if we are going to be reopening the states and the territories, that we need to make sure we have testing capabilities. And again, they talked about their ability from a national level to provide those capabilities and working very closely with commercial laboratories. They also talked about the importance of these test kits and these test machines to be FDA approved. They have relaxed their regulations a little, meaning that if you are a commercial lab that is FDA approved and manufactures, say, the swabs, the test kits, and so forth, and there's a change or an alteration of the swab, the test kit, and so forth, that they can go ahead and do their own a manufacturer's validation. They need to still validate it to make sure the test is reliable, the results are reliable, and FDA does not have to come to revalidate them. They will honor the manufacturer's validation, and they would have to report it to FDA, and FDA then will have a record and approval for that. So they talked a
Thank you,
lot
Governor.
about that. They again talked a lot about it's the governor's really it's the governor's decision about when to open and when to continue on, when to open and how to open, using, of course, their guidelines. And again, very clear that fundamental preventive measures continue on.
Thank you, Governor. So for the second question, as you may know, the financial reports, the monthly financial reports are out, and we are anticipating or projecting, it seems like an 8 million drop in the general fund revenues compared to adopted revenues. That includes things like the federal aid that we're anticipating.
Right.
So I did ask yesterday about the federal stimulus checks. I don't think it's very clear yet that when we're going to get that approval from the U.S. Treasury. Meanwhile, the CNMI has stated that the IRS indicated they'll be getting their checks by maybe by mid-May. At the same time, it was about 2 or 3 weeks ago that you stated the unemployment assistance program would be launching in about the same time frame. Clearly, that's just not that timeline is no longer applicable. So maybe the timelines are not quite solid yet, Governor. But the question is then, when can Guam anticipate to get its stimulus check, and when can Guam anticipate that the unemployment program will launch, and what are you basing that estimate on?
Okay, so the stimulus check, let me just write this down so I don't forget. So the stimulus check is going to be, actually we are already giving out the stimulus check. Some people have already received their 1,200 and their 2,400. So I know that we have already sent out about maybe 4,000 of those checks, and also I do know that the children are also getting their 500. So the stimulus check has been distributed. We expect the federal monies to come in probably in maybe the first week of May. And as far as the pandemic unemployment benefits, that one we are getting our processes and everything ready so that when the money starts coming in, we can start giving them out. This one is a much more complicated process, John, because it involves identifying people who are unemployed. It involves working with the employers. It involves an application of the unemployed employees. It involves a criteria of conditions that has to be met by the people who are unemployed. It involves about 2 or 3 pages of application, which is a little bit more complicated than just looking at your tax rolls and giving out the money. And so,
can you give us a new timeline on that then?
Well,
is it possible to give a new timeline at this point?
Yes,
Okay,
I'm
thank you,
getting
Governor.
to it. So the process is that right now, what we're doing is we're training up our people. We are in the process of hiring about 50 people that will be able to work the program. We are now working very closely with our vendor for online. We will probably be able to get online application maybe in a couple of weeks. So we're laying all the ground, and once the checks start, once the money starts coming in, we can just go forward. We can also begin employee applications manually. We prefer to do employee applications online. So I would say maybe the second week of May, second, third week of May. Is that, do you think so? Yeah.
Thank you, John. I-94, Adriana Gutierrez.
Hey. So I have a question for Linda on the community testing. Can you provide further details on the pilot project beginning this Saturday in Estumbo, a rundown of how it will operate, and then when expanding, how will the pockets of village areas be determined? Will village mayors be part of this process to identify high-risk populations? You know, as they just found out last week, Friday, how many COVID positives are even in the village? And then how will people be receiving info on the community COVID testing altogether?
Yes, right now, as I speak, we had a planning committee that we mobilized, which includes public health and of course the other, the mayor's council. Our representative was Mayor Savares. And we looked at all the details in terms of how the swaps are going to be done, and are we going to have the perimeters, making certain that it is well secured, making sure that we also have an ambulance there should anybody have any emergencies at that time. We're looking at a drive-through towards that perimeter that we are identifying, and looking at just like you said, a pilot study. We're looking at a small sample size to start off with. And what we're trying to do is we're trying to involve not only the department, but also other agencies that will be involved in this project, as you know. Of course, working with the Physicians Advisory Council and all this, so that we're all in line in terms of identifying and moving towards, of course, these pocket areas that you're identifying. We are working with the mayor's council, and we're looking at representatives of all this area. But I'm just going to elaborate for now on the pilot project that you're asking. And again, we're launching it so that it will meet our sample size. As you know, Dedido is a highly populated area. It also has high risks involved in the patients that are there. And we're looking at mild illnesses, patients that come in. We're doing case findings. That's what we're really focusing on. As you know, we're continuing our efforts with identifying the clinics to expand, and that will continue, whether they are seen at the private clinics, at the public health clinics, or even at the hospitals, both GMH and GRMC. In this particular case, it's case findings, and that's what we're elaborating on, so that we can identify these mild cases, and they will eventually present themselves. We will notify the targeted group, and that will be done so that they know what form they're going to fill up, and be prepared in having that form completed, and they will be notified through a flyer that will be distributed to them. And we're getting the mayors to be involved in that process. And so that in a nutshell is the activity. And of course, working with other government of Guam agencies and the TAC, the National Guard, to maintain the perimeters, ensuring security and so forth. And so that's where we're at. And as the governor had indicated, that's what we're gonna do, as she had indicated.
So just following up on, Governor,
No, I just wanted to ask if Dr. Cruz can chime in and how we're gonna work together cohesively so that we move forward and end up being in line, and again, going to identify other individuals.
So this pilot study is going to proceed, but it's going to be a part of a larger overall community testing protocol that's going to be marched out. We have, again, as Linda stated, a planning session this afternoon with the Physician Advisory Council Committee, along with public health officials. And so she's going to identify this one pilot study, but we also want to make sure that the vulnerable populations, those are the, as the governor stated, multi-generational, multi-family homes, end-stage renal patients, those with significant comorbidities, frequent flyers to the hospital that we know that are coming back and forth to different hospitals, to either GRMC or GMH. These are vulnerable populations that if we don't identify, make sure that there's not a cluster or a positive within those particular communities, they will in fact be the ones that are going to overwhelm our healthcare system, especially the intensive care unit. So again, as we do this, there's going to be multiple fronts moving forward to ensure that we have cast a wider net on this community so we can get a better understanding as to the prevalence of the disease so we can safely reopen back our island to and its economy.
Okay, so yeah, following up on that, you said you're currently speaking with your planning committee or planning group. Who all is within that planning group? And then have you guys discussed, and can you inform us the hours on Saturday as well? How many will be in the sample size and where in Escondido?
Yeah.
Yes, so as I mentioned in my opening remarks, it's this Saturday from 9 to 12 p.m.
And who is involved in the planning committee? Of course, the Army National Guard. We also have the fire department and police department as part of our planning, and the mayor for the representation for the mayor's council, and my team at the Department of Public Health, Dr. Kane Hancock from CDC, and we're all involved in this endeavor, and of course with a lot of support from the Physicians Advisory Council, and of course our governor.
Thank you, Adriana. PDN, Steve.
Yes, hi, Governor.
Hi, Steve.
Hi. So just going back to the pilot testing program, I mean, you mentioned, so it's a Astimbo-Dedido. What is it exactly about Astimbo-Dedido that makes it a good place to launch this pilot program? What sort of high risk are you looking for?
Right. The fact that we have the mayor with us and the fact that it's a densely populated area in Dedido. Of course, there are other areas that we can look at, and we are intending to do that. We're starting in that particular area because they're the most vulnerable and they're most high risk. And why that area in particular? Because a lot of them don't have access to care, and some of them have also barriers to care, i.e. they just don't have transportation, or they have cultural barriers, or there could also be a case where they have illnesses and they just don't seek medical care due to lack of insurance, uninsured. And so we also identified that this is an area that we can examine, and there are also, as the governor indicated too, multi-generations that occur, and they also may have other high morbidity conditions that we could also identify along with the fact of their geographic location.
Okay, and so how many government employees are going to be descending upon Astimbo-Dedido on Saturday, and what can people expect? Are they going to be going door to door?
Yeah, it will be all my public health staff, and again, all that detail we will provide you at a later time as we journey through, and we want to make sure that we're all in great planning to make it as effective and efficient as possible. So we can get that information to you at a later time.
Thank you, Steve. KOAM, Nestor LaConcha.
Just wanted to go back to the stimulus check question. I know that you said that you're expecting money from the Treasury the first week of May, but I think that's referencing the $11 million from the war claims. What about, I think it's $134 million that we had requested through the Director of Rev and Tax, Daphne Shimizu, to Treasury. When is that coming in?
Okay, so right now we are advancing that, Nestor. And so we are advancing the checks that we have already put out. And as you know from previous press conferences, that we had to decide how much we could afford and who are the most who are in most need. I know everyone is in a lot of need, but we had to have some kind of guidelines. So we identified those whose adjusted gross income is 10,000 and below, and or dual joint filing of about 150,000. So, oh, sorry,
Governor,
10,000 and below. So those we already sent out. The 134 million is calculated based on the 2018 filing. And so I think Daphne mentioned it's about 63,000 people. And so that's how they came up with the 134 million. That money we expect to be coming in first week of May.
oh, okay. So, and then how soon after that will the checks be cut?
Right away.
When can people start to?
Yeah, as soon, see, the holdback in this whole thing is the implementation plan, which Daphne had submitted, maybe 3 weeks ago. And so we're waiting for that implementation plan to be approved. Once that plan is approved, they will distribute the monies to us, and then we can distribute the checks right away.
Thank you, Nestor. Pacific Island Times, Johanna Salinas.
Half a day, everyone. Hi.
Hi,
So-
Johanna.
Hi, Governor. So my first question is, what have we learned from this crisis so far?
Oh my gosh, what a big question. I think throughout the world, it's an unprecedented situation. No one has ever really gone through this kind of crisis. So as we evolve and we move along, we learn along the way. We learned that the virus is a virus that's actually very uncertain in terms of its behavior. It's a novel virus, so the scientists are not familiar with this virus. That's why we were really very, we were very cautious and conservative. It provides uncertainty. That's the whole thing that we learned about this whole thing, is uncertainty. We can't predict what this virus is going to do because we don't know this virus. It's a novel virus. So as a result of that, everything that we're doing, our mitigation, our measures, all of that, I think evolves as we learn more about this this virus. So I would say what we learned for me is the uncertainty, and how do we address uncertainty, and the fact that we have to act quickly and very seriously because it's uncertain. So we plan for the worst. And I think because of that attitude, that's why we are very successful in flattening the curve. I also know that, I'll tell you what I also learned. I learned that we have a lot of good, talented people in government that have stepped up and made the commitment to fight this virus. I learned that we had to really be very quick in our decisions. I learned that we need to have some more control in terms of quarantining and isolating. I learned that we have to be very adamant about not allowing people into our island that are from hot spots. I learned that we identified the source of the contact, which is a traveler from the Philippines. So because of that, we then made the decision to mandatorily quarantine people that are coming in. I learned that by taking those very strict measures that we are successful where we're at. I think that's
We
a
can
lot.
actually learn as well by looking back at history. And I think that if we just go back to almost a little bit over a century ago, in 1918, the Spanish flu, that was a different virus then. I think it was an H1N1 type. But it was at that time that, again, a visiting boat, naval boat from the Philippines came to Guam. And we thought maybe we were immune from it. Maybe we thought we were isolated from it. But you know what? 4.5% of our population died at that time.
That's right.
Furthermore, what we can learn is the fact that that first wave of the Spanish flu killed maybe 4 to 5 million people throughout the world. But it was the second wave that actually ended up killing almost up to 50 million of the people. So we have to be prepared. We have to be resilient, and we have to make sure that as we we opened back our island that we're not going to get back into another second wave. And so a lot of things, it's an unprecedented crisis, as the governor stated. And I think to a certain extent, Governor, you've done a good job as far as the mitigation efforts, but we can't let our caution down. I mean, we continue on.
I agree. Yeah, and containment is very, very critical in order for us to prevent the further transmission. And early identification and isolation and quarantine are all critical measures that have to be in place in order to have containment of this virus.
Thank you. Sorry, your next question, Joanna.
Okay, so my next question is related to the first one. So besides healthcare, what other areas need improvement as a result of this crisis?
What other area? In government or? I think, well, I just have to say that we learned also that, people will commit and people will support and people will be able to do your directives. I think area of improvement will always be making sure we communicate. Because the more we teach and communicate our people, the better I think we will be in effectively, instituting and implementing our program and our plan. So I think communication, as you know, there's always room for improvement in communication.
And I like to add, in terms of communication, getting the right messages out, the factual information, so that the public can know what is correct and what is really real.
Yeah. I think one thing and that's very important is people have to get information from an official entity. And we cannot be having 3 or 4 different kinds of communication out there that may not coincide and be consistent. And so people need to understand that information from an official entity is what they should be following and what they should be using and so forth. It's very important. It's very important to be very coordinated, organized, and working together is very key.
I think the other thing that, as far as non-medical, would be because of our geographic isolation and the fact that our ocean is a barrier to not only a novel virus coming here, but a barrier to any help coming here. So as an island, we need to do more efforts towards self-reliance and being able to, be supportive of ourselves, making sure that there's the proper stockpiling of needs that we have here in Island. Also, again, growing our own food and our own crops. And so, because at some point, our geographic isolation is going to be both a blessing and a curse. And so that as the governor has stated.
Thank you, Johanna. Finally, Nick Delgado with a point.
Hi, Governor. Hi, Dr. Cruz. Hi, Linda. So my first question's in regards to testing. The 311 text this morning that was sent out had made mention of how COVID-19 cases are decreasing, but without starting the expanded testing, how certain are you that cases are actually decreasing without a baseline? Even with DLS and GMH testing, it appears Guam has only tested, I believe, less than 1% of the population. Plus, you said the expansion will be 258 tested daily. How can we do more to get to everyone sooner? Because with that average, it seems like it would take 2 years to get to everyone. In addition,
Absolutely.
Will rapid testing be used for this pilot study?
So if I look at our capacity for testing, Nick, we have almost close to the ability of testing 1,000 a day. And that's
Nice.
Again, if all of the test machines are working, if all of the test kits are there. So just by looking at this data and information that FEMA and also our discussions with our medical discussions with FEMA, that we can have that capacity. And we are going to work very hard to get them. And if they are all up and running, we have that capacity. The other thing is we also have a contract with DLS, which is our commercial laboratory, and they can do about 350 tests a day. So yes, I will just say this. Of course, my goal is try to test everyone, but that's an impossibility. That's a reality. I think that it's not going to happen. But if we can test as many as we can, given our resources, we'll do that. And we have to sustain that testing capability moving forward because it's going to be a while till, say, vaccination comes in. And then once that happens, we'll probably just be on surveillance and, not diagnosis and monitoring and treatment.
Absolutely. If I could just add also that we don't even, what the governor is talking about was put without DLS in the picture. And I think that we have a unique opportunity here on Guam, even as a smaller island with a smaller population, to probably test a larger percentage of our people than even they do in other places. We be mindful of the fact that the United States has only tested about 3.5 million people, which is only 1% of their population.
Good point. The other part to that question was about the rapid testing. Will that be used during the pilot study?
Yes,
Linda?
to answer that question, we're going to try to use the rapid test, yes, because we like to reserve the other tests for, again, having the capability for the priority groups for the hospital and GRMC of those patients that are at high risk in that regards. And so those are the patients I'm talking about that are hospitalized with COVID positive cases. And so we're going to be utilizing that. And if the need arises and we have to tap on DLS, then we will also be sending those specimens out as well. So the answer is yes.
Okay. I know you said that those will go to DLS and off island. So thank you for that response, Linda. The second question, I want to bring to you guys a question from one of our readers. She writes, my grandmother and sister both tested positive and were told to self-quarantine. After 21 days, we're told they were clear. No retests, no follow-up. However, for the safety of others, they have been home and still in quarantine. It has been 33 days and still no follow-up from public health. My grandmother has residual coughs since she was told that she recovered. So the question is, she wanted us to ask if any of those who have recovered have been retested before they were deemed recovered, how many, and if not, is that an option you guys will revisit?
Yeah, well, I really definitely would like to know this particular individual, and I'll definitely look into that because I know that those that are in our home quarantine or home isolation, that we really take every effort to actually call them. We have a whole team of our isolation quarantine teams that do make the call. And usually when they're cleared, what normally happens is if they're in home quarantine, home isolation, if they're COVID positive, to clear, it would be about 72 hours without any symptoms, and then and 1 week without symptoms, and from the time of the first start of that symptom that occurred in that day. So if you have a number, a name of that individual, I really would like, as the Director of Public Health, to look into that, and I want to make certain that that is taken care of and find out information as far as what is, what happened there. So if you can share that with me, Nick, I'd be more than happy to look into that.
Also, Nick, I'm concerned that you said the grandmother was having some residual cough, that the grandmother should really make sure she goes to her doctor, or if she starts having shortness of breath, make sure they come to GMH or call 911. And again, without knowing more details about it, was she told to self-contain at home by public health? Was she initially checked by public health? Or what, did she just call the doctor and the doctor just said, oh, your symptoms are mild, just stay home? Those are the kinds of details we need to know.
And we also,
because it is a concern that we have to make sure we follow up those people.
Exactly. And again, we also have a whole call center that has our experienced seasoned nurses that are taking all the calls and answering questions that they may have. We start off with that. We direct the patient. If again, if they are symptomatic, to definitely call their clinic. That is what the nurse at the call center will definitely tell them, especially if they have comorbid conditions or they have, they're elderly. And again, they will provide that resource and that information to them. And from there, the patient should either report to any of their private clinic, preferably their private doctor. And if they don't have one, they're welcome to go to any of the public health facilities, northern, southern, or central, and they will be seen. And they will also get a nasopharyngeal swab. And then from there, we gather the team together and do the contact tracing and follow up in the surveillance.
I think we can get the information from the.
Yes, I'm very interested because
Linda.
that's a concern.
Yeah,
for
the
me.
reader,
Yeah.
We'll be in contact with Nick.
Yes,
We'll pass
Nick
on that
will,
information.
we'll look into that definitely.
All right, thank you, Nick. And now for some closing remarks from our governor.
Living through the social isolation measures is not easy, but I know some in our community have been affected more than others. But for them, this isn't just a public health issue, but an economic one too. While the government works to provide some relief, our island has shown so much generosity. The very core of our people is to help one another, to share our strength and our burdens through good times and bad. Whether it's someone who has lost their job and is without food, or seniors who must shelter in place for their own safety, the Salvation Army is helping to deliver the essential items they need. Every day, the Salvation Army delivers food to families affected by COVID-19. From April 13 to April 17, Salvation Army has assisted 142 families, totaling up to 671 individuals, many of whom are new to their program. Just as they have done before, they continue to meet the daily needs of our most vulnerable population. Thank you, Salvation Army, for being a COVID hero. Thank you, and to Jews Mafia.
Thank you, everybody. We'll see you again tomorrow. Stay safe.